Interim operational considerations for implementing the shielding approach to prevent infections in humanitarian settings. So now camps are going to be called the shielding approach. The document presents considerations from the perspective of the U.S. Centers for the CDC for implementing the shielding approach in humanitarian settings as outlined in guidance documents focused on camps, displaced populations, aka homeless and all those about to lose their homes, and low resource settings. So if your income is low, you're automatically in a group regardless of whether that income is sufficient for you. Who's determining what's low? This approach has never been documented and has raised questions and concerns among humanitarian partners, aka UN, who support response activities in these settings. The purpose of this document is to highlight potential implementation challenges of the shielding approach from CDC's perspective and guide thinking around implementation in the absence of empirical data. So as we've seen all along, they have no scientific evidence for anything they're spewing to us, but they'll still guide thinking around the absence of any empirical data. Considerations are based on current evidence known about the transmission and severity of the scamorama and may need to be revised as more information becomes available. What is the shielding approach? So, the shielding approach aims to reduce the number of severe cases by limiting contact between individuals at higher risk of developing severe issues and the general population. High-risk individuals would be temporarily relocated to safe or green zones established at the household, neighborhood, camp sector, or community level, depending on the context and setting. They would have minimal contact with family members and other low-risk residents. So, good morning, YouTube. JT Serenity Farms Prepping here. Thought you might be interested in what is coming for us and has been planned all along. You see how they're introducing internment camps? They've simply renamed it the shielding approach. How they're going to protect low risk or high risk individuals from each other by separating families. Okay, so what they're not saying in here is odds are good you're going to be potentially quarantined first, mandated, have to check in daily or be checked up on, which has been done already. If it's determined your whole household has been infected, that will be shut down. If it's determined only one person is, they will very likely be removed and placed in a neighborhood area, maybe a local high school gym or community center with other individuals. If that's not going to work, then a community could be fenced off, which also happened early on last year in the scamorama. And if that doesn't work, people will be hauled away and placed in camps. Their words, not mine. So, let's take a peek at the levels that are going to be assigned to individuals, shall we? So, level 1 is household level, or HH. A specific room or area designated for high-risk individuals who are physically isolated from other HH members. Movement and interactions allowed with HH level. Low-risk members should not enter the green zone. If entry is necessary, it should be done by healthy individuals after washing hands and using. Interactions should be at a safe distance of, let's say 6 feet. Minimum movement of high-risk individuals outside the green zone. Low-risk members continue to follow their spacing and hygiene practices outside the home, aka green zone. Neighborhood level. A designated shelter group of shelters, maximum 510 households within a small camp or area where high-risk members are grouped together. Neighbors swap households to accommodate high-risk individuals. The movement interactions are same as HH level. Now we have the piece de resistance, the camp/sector level. A group of shelters such as schools, community buildings within a camp sector, maximum 50 high-risk individuals per single green zone, where high-risk individuals are physically isolated together. It's hitting me right here. The movement and interactions are: one entry point is used for exchange of food, supplies, etc. Exchange appears to be the new word for rationing. Okay? A meeting area is used for residents and visitors to interact while practicing safe spacing. No movement into or outside the green zone. Okay, folks, what you see here is from Tennessee Governor Bill Lee, received August 6, 2021, and it is an executive order signed by the governor in order to facilitate the continued response. Okay, it's rather long, but it's under the guise of staffing shortages and healthcare providers being pulled from one area to another. For instance, he uses a lot in here that due to increased hospitalizations, all nurses and other type of medical staff will be pulled from mental and behavioral facilities. So in order to compensate for those shortages, he is allowing out-of-state healthcare workers to practice in Tennessee. Now, that's not anything that doesn't happen in every other state. There are plenty of traveling nurses around. He's allowing retired medical professionals to easily re-enter the healthcare workforce. And the previous policies have been suspended to the extent necessary to give the Commissioner of Health the authority to grant these people back a license, certificate, or registration to a healthcare professional that is retired. He's also going to allow nursing students and graduates to practice under supervision without having taken their final exam and actually passed a test. Nothing can go wrong there. Okay? And they list all the people that can or cannot apply for this, which is basically anybody except the maintenance guy. So these I'm scrolling through are all the people that could be pulled from their positions to work in hospitals and all the people that are going to be allowed to take their places. Okay, but as you pull all the people, like this number 5 right here, behavioral health, inpatient, psychiatric, residential, and crisis care staffing flexibility is permitted pursuant to an approved plan to relieve the capacity strain on certain staffing functions. In other words, you ain't going to be able to say that ain't my job or that's out of title work. All right, so, but what I wanted to get to is number 8 here. Discretion to utilize National Guard and State Guard members in connection with certain healthcare and emergency services operations. Okay, now, I don't know how I feel about this one. I'm reading it, and the wording seems to make sense in a time of crisis until you get down to number 14. Telephone assessments for involuntary commitment cases are permitted. The provisions of Tennessee Code annotated section 334108 are hereby suspended to the extent necessary to allow the issuance of a certificate of need for the emergency involuntary commitment of a person with a mental illness or serious emotional disturbance based upon a telephone assessment. Yikes! So as you can see, this order took effect at 11:59 Central Time on August 6, 2021, and is in effect until 11:59 on October 5th, 2021. The order supersedes Executive Order number 82, which is hereby repealed. Now, Governor Lee is supposedly a Republican. As we know, there are a ton of rhinos out there, but up to now, everything I've been following in Tennessee as I contemplated a potential move there has been decent for patriots in terms of freedom of speech and movement and many other of our God-given rights. So this part of me understands the needs when there are staffing shortages, facility shortages, things of that nature. I've been there, done that in my law enforcement career. But we didn't repeal virtually every existing rule that was on the book to compensate for whatever situation we might have found ourselves in. You just can't do certain things because it makes you feel good. That never works. Now, I'm not saying that Governor Lee is part of the deep state, but I do find it troubling that I discovered this memo, executive order, and then the CDC clearly is more than ready and has already been taking steps to have the camps. My personal feeling is they threw in the household isolation, the neighborhood isolation, the community room isolation, all just to soothe the sheeple and make them think that's as far as it's going to go. I think everyone should go to the CDC website and read that very disturbing camp memo for themselves, and maybe this will help you all realize what is truly coming, and very likely may be mentioned in the speech tonight at 8 p.m. by the illegal regime. Pay very close attention. His wording will be, well, maybe unintelligible. I've hired an interpreter. No, but no matter what he says, there'll be an alternative meaning. It's all about phrasing, okay? They know that the sheeple are going to be watching this, and few patriots like myself and many others, we watch it to hear what he really means. The sheeple watch it to hear what they want to hear. So this is why we need to get our own community groups ASAP, folks. There is no time like the present, because there very likely isn't a tomorrow. So it got a little long, but I thought it was important that you see that document because it's coming. Like, share, subscribe, comment, notification bell. But for now, JT signing off.